Question 1. In the context of nuclear cardiology, a 65-year-old male patient, Mr. Thompson, presents with chest pain and a history of hypertension and smoking. His doctor recommends a myocardial perfusion imaging (MPI) study to assess myocardial ischemia. The physician orders both stress and rest images using TC99 SNMMI. During the stress portion, the patient is administered adenosine to induce pharmacological stress. What is the main purpose of using adenosine in this case? A. To increase heart rate and induce exercise-like conditions. B. To inhibit vasodilation in coronary arteries and provoke ischemia. C. To enhance myocardial uptake of the radiopharmaceutical. D. To induce vasodilation in coronary arteries to assess blood flow. Answer. Correct answer, D. Explanation. Adenosine is used as a pharmacological stress agent in MPI because it induces vasodilation in coronary arteries, which simulates the effects of exercise by increasing blood flow. This allows the physician to assess whether ischemia, reduced blood flow, is present in the myocardium. In contrast, exercise stress would increase heart rate and myocardial demand, but adenosine provides a controlled alternative for patients unable to exercise. Option A is incorrect because adenosine does not increase heart rate. Option B is incorrect because adenosine does not inhibit vasodilation but actually promotes it. Option C is incorrect as adenosine's primary role is vasodilation, not enhancing radiopharmaceutical uptake. Question 2. What would happen if a patient undergoing a TNT9 SNMMI scan for myocardial perfusion imaging is not properly instructed to avoid caffeine for at least 12 hours prior to the study? A. It may lead to inaccurate results due to caffeine-induced coronary artery constriction. B. The radiopharmaceutical will have an enhanced uptake in the myocardium. C. It will cause the heart rate to increase, making it difficult to assess myocardial perfusion. D. It will cause an increase in the required radiation dose during the procedure. Answer. Correct answer A. Explanation. Caffeine is a vasoconstrictor and can interfere with the pharmacological stress agent e.g. adenosine by causing coronary artery constriction, leading to inaccurate imaging results. This could falsely suggest that there is no ischemia when, in fact, there is reduced blood flow in certain areas of the myocardium. Patients are instructed to avoid caffeine for at least 12 hours before the procedure to prevent this issue. Option B is incorrect because caffeine would not enhance the radiopharmaceutical uptake. It would disrupt the test's accuracy. Option C is incorrect because caffeine does not significantly impact heart rate in a way that would affect perfusion assessment in the context of pharmacological stress. Option D is not accurate because caffeine does not increase the radiation dose. Question 3. During a T99 SNMMI SPECT imaging procedure, the imaging technologist notices a hot spot in the anterior wall of the heart where the radiotracer uptake is significantly higher than expected. What should be the first step in investigating this potential artifact? A. Reposition the patient and repeat the scan. B. Evaluate the patient's history for any recent surgical interventions. C. Check the imaging equipment for any misalignment or malfunction. D. Administer an additional dose of radiopharmaceutical to confirm the finding. Answer. Correct answer, C. Explanation. The first step in addressing potential imaging artifacts is to ensure that the imaging equipment, particularly the camera and collimator, is properly aligned and functioning correctly. Misalignment or malfunction of the equipment could lead to artificial hotspots. If the equipment appears to be functioning correctly, the next step would be to consider other potential causes, such as patient positioning, history of recent surgeries, or other technical issues. Option A and Option D would not address the root cause of the artifact and would not help resolve the issue effectively. Question 4. Given the circumstances, a 70-year-old female patient, Mrs. Jenkins, is undergoing a PET scan with F18FDG to assess myocardial viability. Her clinical history includes poorly controlled diabetes. What precautions should be taken before the procedure? A. Ensure that her blood glucose levels are elevated to enhance the uptake of F18FDG. B. Ensure that her blood glucose levels are properly controlled to avoid inaccurate results. C. Administer a dose of insulin prior to the procedure to increase radiotracer uptake. D. Avoid administering any oral medications to her before the scan. Answer. Correct answer, B. Explanation. Proper glucose control is critical in FDG PET imaging because elevated blood glucose levels can result in excess glucose in the bloodstream, leading to inaccurate uptake of F18-FDG by the myocardium. And a patient with poorly controlled diabetes, hypoglycemia could compete with FDG, causing reduced myocardial uptake and affecting the interpretation of the scan. Therefore, blood glucose levels must be controlled before the procedure. Option A is incorrect because elevated glucose levels are detrimental to the accuracy of the scan. Option C is not recommended as insulin administration is not part of the standard procedure. Option D is incorrect as most oral medications are not contraindicated before the scan unless specified by the protocol. Question 5. What is the primary purpose of using gated blood pool SPECT in nuclear cardiology? A. To assess the myocardial perfusion during exercise stress testing. B. To evaluate left and right ventricular function by analyzing wall motion. C. To detect coronary artery blockages and determine ischemia. D. To determine the size of the infarcted area in patients with myocardial infarction. Answer. Correct answer B. Explanation. Gated blood pool SPECT is used to evaluate left and right ventricular function, including wall motion and ejection fraction. This technique allows for the analysis of the heart's mechanical function by acquiring images at different phases of the cardiac cycle, which is essential for assessing patients with heart failure or arrhythmias. Option A is incorrect because gated blood pool imaging is not primarily used for myocardial perfusion assessment. Option C pertains more to myocardial perfusion imaging, MPI, which is focused on detecting ischemia. Option D is more related to infarct size determination through imaging modalities like PET or MRI rather than gated blood pool SPECT. Question 6. During a myocardial perfusion imaging MPI study, a technician observes a discrepancy in the stress and rest images of a patient with suspected coronary artery disease. The rest image shows normal perfusion, but the stress image reveals a significant defect in the inferior wall. What is the most likely explanation for this finding? A. The patient may have a fixed defect that does not change with stress. B. The stress portion of the exam was improperly conducted, leading to a false negative result. C. The radiopharmaceutical was not injected correctly during the stress phase. D. The patient may have a transient ischemic defect that resolves at rest. Answer. Correct answer D. Explanation. The most likely explanation for this finding is that the patient has a transient ischemic defect. In cases of coronary artery disease, areas of ischemia may only be evident during stress and can resolve at rest. This indicates that blood flow to the region of the heart was temporarily reduced under stress but returned to normal when the stress was removed. Option A is incorrect because a fixed defect would show up similarly in both stress and rest images. Option B and C are not the most likely explanations given the normal rest image and the defects seen only during stress. Question 7. What is the primary advantage of using PECT imaging over SPECT imaging for myocardial perfusion studies? A. PECT offers superior spatial resolution, allowing for more precise localization of perfusion defects. B. PECT can evaluate myocardial metabolism and viability in addition to perfusion. C. SPECT is a more cost-effective imaging option compared to PECT. D. PECT uses less radiation than SPECT for equivalent diagnostic accuracy. Answer. Correct answer B. Explanation. One of the primary advantages of PECT over SPECT is that PECT can evaluate myocardial metabolism and viability in addition to perfusion. This allows for more comprehensive diagnostic information, particularly in patients with complex coronary artery disease or heart failure. Option A is not entirely true since SPECT and PET both provide high resolution, but PET has the added benefit of assessing metabolic function. Option C is incorrect as PET is generally more expensive than SPECT. Option D is incorrect because PET typically uses higher doses of radiation compared to SPECT for similar procedures. Question 8. What would be the potential consequence of administering a radiopharmaceutical to a patient who has recently undergone AQ with iodinated contrast agents? A. There could be an enhanced uptick of the radiopharmaceutical in the heart muscle. B. The iodinated contrast could interfere with the imaging quality, leading to artifacts. C. The patient's kidney function will improve, enhancing the uptake of the radiotracer. D. The radiopharmaceutical could be metabolized more rapidly, decreasing image quality. Answer. Correct answer, B. Explanation. The use of iodinated contrast agents in CT scans can cause potential interference with nuclear imaging quality. Iodine has a high atomic number, which can lead to artifacts on nuclear imaging, particularly when radiopharmaceuticals are injected shortly after CT scans. These artifacts can obscure accurate assessment of the myocardium. Option A and C are incorrect, as the contrast does not directly affect radiopharmaceutical uptake. Option D is not correct, because the radiopharmaceutical is not metabolized more rapidly due to the contrast. Question 9. In light of recent developments in nuclear cardiology, why is it important to monitor patient radiation exposure during procedures like PET and SPECT imaging? A. To ensure that the patient's radiation dose does not exceed safe limits. B. To calculate the exact amount of radioactive decay occurring during the imaging process. C. To determine the optimal radiopharmaceutical for each patient based on their radiation sensitivity. D. To track the patient's exposure history for future diagnostic studies. Answer. Correct answer, A. Explanation. Monitoring radiation exposure is crucial to ensure that the patient's dose does not exceed established safe limits. Overexposure can lead to potential long-term health risks, including an increased risk of cancer. This is in line with radiation safety principles such as the ALARA, as low as reasonably achievable concept. Options B and C are irrelevant to the purpose of radiation monitoring during patient imaging. Option D is secondary consideration but does not address the primary reason for monitoring radiation exposure. Question 10. Which of the following is the most appropriate step when troubleshooting a poor quality SPECT myocardial perfusion image that shows blurred or distorted myocardial borders? A. Reposition the patient and repeat the scan with a different radiopharmaceutical. B. Adjust the collimator or gamma camera settings to improve resolution. C. Increase the radiation dose to improve the image quality. D. Wait for the next available time slot and repeat the imaging after several hours. Answer. Correct answer, B. Explanation. Adjusting the collimator or gamma camera settings is the most effective way to improve image quality when faced with issues like blurred or distorted myocardial borders. Poor image resolution can often be improved through proper collimation or optimizing imaging parameters. Option A might not resolve the technical issue, and using a different radiopharmaceutical is unnecessary. Option C is not recommended, as increasing radiation dose does not directly improve image quality. Option D would delay diagnosis and is not necessary in the context of troubleshooting imaging quality. Question 11. In the context of myocardial perfusion imaging and PI using SPECT, Mr. Williams is undergoing a stress test following a recent history of chest pain. The technician performs the test, but there is difficulty obtaining clear images due to motion artifacts. Which of the following actions should the technologist take to minimize motion artifacts during MPI imaging? A. Increase the dose of the radiopharmaceutical. B. Ensure the patient is properly positioned and immobilized before imaging. C. Decrease the imaging duration to reduce the likelihood of patient movement. D. Use a lower energy collimator to improve image resolution. Answer. Correct answer, B. Ensure the patient is properly positioned and immobilized before imaging. Explanation. Motion artifacts in MPI imaging occur when the patient moves during image acquisition. Ensuring proper positioning and immobilization is crucial to prevent such artifacts. Techniques such as using a patient stabilizer or asking the patient to remain as still as possible can significantly improve the quality of the imaging. Radiopharmaceuticals does not directly affect motion artifacts, and reducing imaging time can lead to inadequate data for accurate interpretation. Lower energy collimators are not typically used for motion-related issues, but rather for optimizing energy levels. Question 12. Based on the information regarding radiopharmaceuticals, when using TC99 meters-based agents for myocardial perfusion imaging, which of the following is most likely to cause a delay in myocardial imaging results? A. Poor quality control of the radiopharmaceutical preparation. B. Use of high levels of exercise, stress during testing. C. A patient who has recently consumed a high-fat meal. D. Administration of beta blockers prior to the test. Answer. Correct answer. A. Poor quality control of the radiopharmaceutical preparation. Explanation. The quality of radiopharmaceutical preparation directly impacts the imaging results. Poor quality control can lead to reduced radiopharmaceutical purity or incorrect dose, which in turn delays or degrades the imaging process. Exercise and fat intake may have some impact on myocardial perfusion, but are less likely to directly delay imaging. Beta blockers can affect heart rate and myocardial perfusion, but do not typically delay the imaging results. Question 13. In an effort to assess myocardial viability using nuclear cardiology, Mr. Jackson is scheduled for an FA&FDG PET scan. What would be the best course of action to ensure accurate results? A. Perform the scan immediately after the administration of the radiopharmaceutical. B. Ensure the patient is fasting for at least 6 hours prior to the test. C. Allow the patient to eat a light snack before the test. D. Administer a stress test prior to the scan to increase myocardial blood flow. Answer. Correct answer. B. Ensure the patient is fasting for at least 6 hours prior to the test. Explanation. F18-FDG fluorodeoxyglucose PET imaging is used for assessing myocardial viability. A fasting period of at least 6 hours is necessary for accurate results because it reduces the background glucose uptake in non-cardiac tissues, leading to clearer images of the myocardium. Administering a stress test is not required. Viability imaging with F18-FDG, as it primarily assesses metabolic activity, not blood flow. Light meals prior to the test can interfere with the uptake of the radiopharmaceutical, resulting in inaccurate readings. Question 14. When analyzing a cardiac PET scan for myocardial perfusion, which of the following would be considered an abnormal finding? A. Homogeneous distribution of radiotracer throughout the myocardium. B. A clear absence of radiotracer uptake in the apical region of the left ventricle. C. Reduced uptake of radiotracer in the subendocardial region of the myocardium. D. Increased uptake of radiotracer in the septal region of the left ventricle. Answer. Correct answer. C. Reduced uptake of radiotracer in the subendocardial region of the myocardium. Explanation. Reduced uptake of the radiotracer in the subendocardial region typically indicates myocardial ischemia or infarction, suggesting a pathological condition. A homogeneous distribution A is indicative of normal perfusion. The apical region B may show reduced uptake in certain conditions, but this is not necessarily abnormal on its own. Increased uptake D could suggest inflammation or hyperperfusion, depending on the clinical context, but it is less suggestive of ischemia. Question 15. Given the circumstances, MS. Harper is undergoing a pharmacological stress test using adenosine. Which of the following is the most important precaution to take when administering adenosine in a patient undergoing a nuclear cardiology study? A. Ensure that the patient is receiving a consistent dose of the radiopharmaceutical throughout the test. B. Monitor the patient's blood pressure and heart rate frequently during the administration of adenosine. C. Discontinue any medications that could interact with adenosine before the procedure. D. Allow the patient to engage in light physical activity prior to adenosine administration. Answer. Correct answer. B. Monitor the patient's blood pressure and heart rate frequently during the administration of adenosine. Explanation. Adenosine induces vasodilation to simulate stress, and it can cause significant changes in heart rate and blood pressure. Close monitoring is necessary to manage potential side effects such as hypotension or bradycardia. Ensuring consistent dose of radiopharmaceutical A is important for accuracy, but is related to the specific risks of adenosine. Discontinuing medications, C, and engaging in light physical activity, D, are not standard precautions for adenosine use. Question 16. Mr. Thomas is undergoing a TNT 9 meters SNMMI stress test to evaluate his myocardial perfusion. If the patient is unable to exercise, which of the following would be the most appropriate pharmacological agent to use for inducing stress? A. Dobutamine, B. Norepinephrine, C. Nitroglycerin, D. Atropine. Answer. Correct answer. A. Dobutamine. Explanation. Dobutamine is commonly used as a pharmacological agent to simulate exercise-induced stress in patients who are unable to perform physical exercise. It stimulates the heart, increasing heart rate and contractility. Norepinephrine B is used for vasoconstriction and not for stress testing. Nitroglycerin C is used to relieve chest pain by dilating coronary arteries, not induce stress. Atropine D increases heart rate but is not typically used for stress testing in the same way as dobutamine. Question 17. What factors contribute to suboptimal image quality when performing myocardial perfusion imaging with SPECT? A. Use of a high-energy collimator for low-energy radiopharmaceuticals. B. Overly rapid injection of the radiopharmaceutical. C. Excessive patient movement during imaging. D. Long acquisition time with high sensitivity. Answer. Correct answer. C. Excessive patient movement during imaging. Explanation. Excessive patient movement is one of the leading causes of image artifacts in myocardial perfusion imaging. It disrupts the clarity of the acquired images, leading to misinterpretations. Using a high-energy collimator, it can reduce image resolution, but it is not typically associated with suboptimal image quality in the same way as motion artifacts. Rapid inject radiopharmaceuticals B can cause uneven uptake, but patient motion is a more frequent cause of imaging problems. Longer acquisition times D can improve image quality by increasing counts, but are unlikely to introduce significant artifacts unless motion is involved. Question 18. When considering radiation safety in nuclear cardiology, which of the following would most effectively minimize unnecessary radiation exposure to the patient during imaging procedures? A. Utilizing the lowest possible effective dose of radiopharmaceuticals. B. Conducting all procedures using PET imaging exclusively. C. Scheduling all imaging tests without regard to the patient's age or history. D. Using high-resolution imaging techniques for all patients. Answer. Correct answer. A. Utilizing the lowest possible effective dose of radiopharmaceuticals. Explanation. The principle of as low as reasonably achievable. A lower applies to radiation exposure in nuclear cardiology, meaning the radiopharmaceutical dose should be kept as low as possible while maintaining diagnostic accuracy. PET imaging B provides high-resolution images but does not necessarily minimize radiation exposure. Age and history C should be considered when deciding on imaging procedures to avoid unnecessary exposure. High-resolution imaging D can increase radiation exposure and is not always necessary for all patients. Question 19. In a study evaluating coronary artery disease using nuclear cardiology techniques, Mr. Clark presents with a history of hypertension. Given his condition, which of the following stress modalities would be the most appropriate choice for his myocardial perfusion imaging? A. Exercise stress test. B. Pharmacological stress with adenosine. C. Pharmacological stress with dobutamine. D. Stress with regadenoson. Answer. Correct answer. C. Pharmacological stress with dobutamine. Explanation. Dobutamine is often used for pharmacological stress in patients with conditions such as hypertension where exercise may be contraindicated due to the strain on the cardiovascular system. Exercise stress may not be feasible in such cases. Adenosine B and regadenoson D are also common pharmacological agents but may not be as appropriate in patients with hypertension as they can lead to vasodilation and hypertension. Question 20. During the process of myocardial perfusion imaging with SPECT, a technologist notices a decrease in the signal quality after the radiopharmaceutical is injected. What is the most likely cause of this decrease in signal quality? A. Improper collimator selection. B. Inadequate patient preparation prior to the test. C. Increased background radiation from nearby sources. D. An incorrect dose of the radiopharmaceutical. Answer. Correct answer. D. An incorrect dose of the radiopharmaceutical. Explanation. An incorrect dose of the radiopharmaceutical can lead to poor signal quality, either due to insufficient radioactivity or excessive activity leading to image saturation. Collimator selection A and patient preparation B are critical but are less likely to cause sudden decreases in signal quality. Increased background radiation C could affect image clarity but less likely to cause such a dramatic issue with the signal quality in this context. Question 21. Mr. Patel underwent rest and stress myocardial perfusion imaging using TC 99 meters SNMMI. The post-stress images show a perfusion defect in the inferior wall that resolves in the rest images. What does this finding most likely indicate? A. Myocardial infarction. B. Balanced ischemia. C. Attenuation artifact. D. Reversible ischemia. Answer. Correct answer. D. Reversible ischemia. Explanation. A perfusion defect on stress images that resolves at rest is indicative of reversible ischemia, meaning the region becomes underperfused during stress but recovers at rest. This suggests viable myocardium with insufficient perfusion under increased demand. Myocardial infarction would show a fixed defect, and attenuation artifacts usually persist across phases or are variable in shape and location. Question 22. During a nuclear cardiology study, the technologist observes liver and bowel activity that obscures the inferior wall of the left ventricle. What is the best strategy to address this? A. Increase the dose of radiopharmaceutical. B. Ask the patient to drink water and wait before repeating imaging. C. Proceed with imaging immediately and apply attenuation correction later. D. Switch to F18 FDG imaging. Answer. Correct answer. B. Ask the patient to drink water and wait before repeating imaging. Explanation. Excess liver or bowel activity is common with TC 99 meters agents and can interfere with myocardial imaging. Encouraging hydration and delaying imaging can help clear background activity. Increasing the dose A or switching modalities. D is unnecessary. Attenuation correction C may not resolve soft tissue overlap in this case. Question 23. Ms. Lynn is undergoing a gated SPECT study for evaluation of myocardial wall motion and ejection fraction. Which parameter is most crucial for assessing left ventricular function in this setting? A. Phase histogram. B. Sum stress score. C. End diastolic and end systolic volumes. D. Heart to mediastinum ratio. Answer. Correct answer. C. End diastolic and end systolic volumes. Explanation. End diastolic and end systolic volumes are used to calculate ejection fraction, which is a critical marker of left ventricular function. The phase histogram assesses synchrony, sum stress, score evaluates perfusion defects, and the heart to mediastinum ratio is used in MIG scans for sympathetic innervation. Question 24. A nuclear medicine physician is reviewing myocardial perfusion SPECT images and suspects diaphragmatic attenuation. Which feature most supports this diagnosis? A. Reversible inferior wall defect without corresponding wall motion abnormality. B. Fixed anterostal defect with reduced thickening. C. Increased lung uptake of radiotracer. D. Decreased left ventricular cavity size at stress. Answer. Correct answer. A. Reversible inferior wall defect without corresponding wall motion abnormality. Explanation. Diaphragmatic attenuation commonly affects the inferior wall, especially in men. It presents as a perfusion defect with normal wall motion, suggesting artifact rather than true ischemia. Lung uptake C may indicate severe ischemia, not attenuation. Anterostal defects B relate more to LAD disease. Question 25. A referring physician asks about using myocardial perfusion imaging to assess a patient with left bundle branch blood BB. Which is the best imaging strategy in this context? A. Stress imaging using adenosine. B. Exercise stress SPECT with TC 99 meters. C. Planar imaging with thallium-201. D. Dobutamine stress SPECT. Answer. Correct answer. A. Stress imaging using adenosine. Explanation. Patients with LBB may show false positive septal defects during exercise due to conduction delay. Pharmacologic stress with adenosine reduces this artifact by promoting vasodilation without increasing myocardial oxygen demand. Dobutamine may worsen septal motion abnormalities. Question 26. A patient with known coronary artery disease undergoes rest and stress myocardial perfusion imaging. Images show a fixed perfusion defect in the anterior wall with wall thinning and absent motion. What does this suggest? A. Viable myocardium. B. Reversible ischemia. C. Myocardial infarction with scar formation. D. Motion artifact. Answer. Correct answer. C. Myocardial infarction with scar formation. Explanation. A fixed perfusion defect with thinning and no wall motion suggests non-viable myocardium, likely from infarction and scar formation. Reversible ischemia typically shows perfusion recovery at rest. Wall thinning is not seen in artifacts or viability. Question 27. During a regadenoson stress MPI, a patient complains of shortness of breath and chest pressure. What is the most appropriate immediate intervention? A. Stop imaging and SARS CPR. B. Administer aminophylline to reverse the effects. C. Give sublingual nitroglycerin. D. Continue with imaging unless elevation is noted. Answer. Correct answer. B. Administer aminophylline to reverse the effects. Explanation. Aminophylline is the reversal agent for regadenoson-induced side effects like shortness of breath or chest pressure. It antagonizes adenosine receptors. Nitroglycerin C may help if ischemia is suspected, but the first-line reversal is aminophylline. EPI is not appropriate unless the patient is unstable. Question 20. In myocardial viability assessment, which of the following findings is most consistent with hibernating myocardium? A. Normal perfusion with reduced glucose uptake. B. Reduced perfusion with preserved glucose uptake. C. Absence of both perfusion and glucose metabolism. D. Increased perfusion and increased metabolism. Answer. Correct answer. B. Reduced perfusion with preserved glucose uptake. Explanation. Hibernating myocardium refers to viable but underperfused tissue with preserved metabolic activity, seen as reduced perfusion and normal increased FDG uptake. Mismatch patterns, reduced perfusion but retained metabolism indicate viability. Match defects, both low, suggest infarction. Question 29. A nuclear technologist notices inconsistent count statistics between different SPECT views. Which of the following most likely explains this issue? A. Excessive gamma camera dead time. B. Motion artifacts due to respiratory movement. C. Incorrect use of energy window settings. D. Patient did not fast before the scan. Answer. Correct answer. C. Incorrect use of energy window settings. Explanation. Improper energy window settings can result in count inconsistencies, especially in photobook-centered imaging like SPECT. Motion can affect image quality but typically doesn't cause consistent count variability. Dead time A and patient fasting D relate more to quantitative or quality issues. Question 30. In quantitative gated SPECT, the left ventricular ejection fraction (LVEF) is significantly lower than that found on echocardiography performed the same day. What could most likely explain this discrepancy? A. Incorrect reconstruction algorithm used. B. Suboptimal tracer injection technique. C. Significant extracardiac uptake obscuring the heart. D. Poor ECG gating during SPECT acquisition. Answer. Correct answer. D. Poor ECG gating during SPECT acquisition. Explanation. ECG gating is essential for accurate wall motion and LVEF assessment in gated SPECT. Improper gating or arrhythmias, e.g. atrial fibrillation, can lead to underestimation of LVEF. Reconstruction methods A or injection issues B would affect image quality, not ejection fraction directly.